Hi, welcome to this IPRS Health webinar series. Today we're going to be talking about understanding pain and developing resilience. So, what we're going to cover today. Start with the first question, which is actually a relatively difficult question of what is pain? How can we explain it? Once we know what it is, how can we explain pain? We'll talk about flare-ups of pain and how you can improve your resilience. So, explaining pain. First things first, how would you define pain? And what I'd like you to do is just take a minute now, if you're in a group to have a discussion, or if you're on your own, just pause the webinar for a few seconds and have a think about how you would define pain. So hopefully you paused that for a couple of seconds and had a good think about it in a group or to yourself. And I'm just going to put the definition up on there now. So it's a distressing perceptual experience for the individual associated with actual or potential tissue damage with sensory, emotional, cognitive, and social components. Now, what does that actually mean? So if we break it down a little bit, pain is an experience. So what that means is it's not a simple cause and effect of touching something and that gives you pain immediately. There's a lot of processing that goes on between that moment and your brain to determine how much pain you experience. And any kind of pain is exactly the same. It's an experience that's based on a lot of different sensory inputs. It can be associated with actual or potential tissue damage. So there doesn't actually have to be any tissue damage present for you to experience pain, which is a really surprising fact. But there doesn't have to be any damage present at all for you to experience pain. And as we said, with sensory, emotional, cognitive, and social components. So what that means is there's lots of different inputs that give you a certain experience of pain. There's lots of different things that contribute to why you might get pain. So if we take you in the middle, there's three different categories that we would generally break things down into to break down what influences your painful experience. They're the biological things. So the state of the tissues is important. So the bones, the cartilage, ligaments, muscles, skin, all of those different things do play an important role in the painful experience. So what is the state of the tissues is one thing. The psychological influence, so fear of movement, past experiences, expectations, beliefs about pain, those things all contribute as well to the level of pain that you experience, which can be surprising, but they do have an actual influence on the level of pain you experience. As well as the social things, support from family, support in work, social isolation, interaction with others, workplace culture. They all influence your experience of pain. Put together, we term it the biopsychosocial model, and they're all equally as important as one another. Not one of those things is more important than the other or influences pain more than another. And in every individual, there will be different elements from each of those three that contribute to how you experience pain. And that's what we mean by a perceptual experience. There's lots of different things that contribute to why you might experience it. So is pain a bad thing? Again, pause it, have a couple of seconds, and think about whether it's a bad thing. Okay, so on the face of it, it seems like the knee-jerk reactions to that question would be, yeah, of course it's a bad thing. It's uncomfortable. It's not nice to experience. No one likes having pain. Actually, pain is a good thing. And starting to think of it in such ways is a good way to start to try and manage it a little bit better. Pain inherently isn't bad. What pain is an alarm system. It's designed to notify us when something is wrong or to motivate behavior change within us. So if we touch a hot stove, it's asking us not to touch that stove. By giving us pain, it's an alarm. Don't touch that, move your arm. It motivates us to move our arm away. Pain is a good motivator. For those people who are unfortunately born without the ability to experience pain, they tend not to have a very pleasant life at all. They can break bones easily when they fall, they can burn themselves, and they generally don't have a good life expectancy. Pain is a positive thing. It's difficult sometimes to understand that when you have it, but pain is a positive thing for the body, particularly in the short term. And as it ticks over into the long term, this is where we want to try and manage it. This is where it becomes unhelpful, and it doesn't act as an alarm should in the long term. So the analogy I like to use is in chronic pain. So if you've had pain for a long time, the alarm system is just a little bit broken. And what's happening is the alarm in your kitchen is going off for a burnt bit of toast. So rather than the smoke alarm working when there's a fire and you need it to work, it's just a little bit sensitive and it's going off too early. It's a little bit too sensitive to change, and even a little bit of burning toast can set it off. And that's what chronic pain is like. Everything is just a little bit more sensitive and the alarm goes off a little bit earlier than it should, and not in proportion to the amount of damage that's there in any way, shape or form. There's no damage to your house when the alarm goes off for the burnt bit of toast, but still the alarm reacts in exactly the same way, and that's the same thing. So we're just going to use another little analogy to describe how the pain works within your body, and it's the Navy analogy. So let's imagine there's a lookout on a Navy ship, and in the distance he sees something that's potentially dangerous, and these can be like the nerves around your spine. So we'll use the lumbar spine as an example, but this could quite easily be your knee or your ankle or your shoulder. It could be any area of the body. So let's take the spine, for example. So the lookout has seen something in the distance that's potentially dangerous, and that's the same as the nerves. They detect things that are potentially dangerous. Now, they don't immediately react and give you pain straight away, just as that lookout doesn't immediately react and start reacting to that thing in the distance. What he does is he passes on the message. Now, this can be like the spinal cord. So wherever there's a signal, it goes into the spinal cord, whether that's from your knee or your back or your shoulder. They all go into the spinal cord. And then that passes on the message to the captain, who is your brain. This all happens subconsciously and all happens in nanoseconds, very, very, very quickly, without any of us realizing that it's going on. Now, what the brain does is it evaluates the situation. It thinks about where you are, the context that you're in. So in this example of the Navy analogy, where are they in the world is relevant. If they're off the coast of Scotland, then it's probably a fishing boat and they don't really need to worry. However, if they're off the coast of Somalia, it's a bit of a different question. There could be a potentially dangerous thing in the distance. And that also is contributed to by past experiences. So sticking with the analogy, if they've had a bad experience before with Somali pirates or something else in the ocean, then that might change their reaction to how they see something in the distance now. It might make them more stressed, more anxious, might put them on edge more. It might make them react a little bit quicker to stimulus that they didn't react to before. It can change the way that you react to certain things. And how big is it? How big is the potential dangerous input that's coming towards you? So quite quickly, the message gets passed up to your brain, and your brain evaluates the situation as quickly as possible and makes a decision on whether it's dangerous or not. In terms of pain, if your brain perceives it as dangerous, which is contributed by all your beliefs and thoughts and feelings as well, then that can give you pain. That can increase the level of pain that you experience. So as we've said before, there's lots of different things that contribute to it, and it's how your brain responds to it based on previous experiences and based on lots of information. It's not as simple as something always equals the same amount of pain. And as we've alluded to already, hurt does not always equal harm. So if we think about sunburn, if we get in the shower with sunburn, it stings and it hurts more and it increases the experience of pain that we have. When you're in the shower, you're not getting more sunburned to give you that pain. It's just more sensitive. The skin is more sensitive. And when we think of pain, we can almost replace it with sensitivity. Whatever is painful, whether that's your knee or your back or your shoulder, the nerves are a little bit more on edge, they're a little bit more sensitive, and they're a little bit more negatively reacting to change. Now it fits in with this sunburn analogy. We're not getting more sunburn when we get in the shower. We're just getting another stimulus, which is giving us a painful experience because we're sensitive. Again, with tissue and damage and pain, if we imagine a fractured arm, hopefully none of you have broken your arm if you're listening to this, but if you have, you would have noticed that when you put your arm in a cast, a couple of weeks pass and you're not really in much pain anymore. Now, we know bone healing takes 6 weeks, so after a couple of weeks, your arm is still broken, but you're not in the same level of pain that you were before. Now, these things can be thought of as kindling to the fire. Now, kindling is not inherently dangerous. Kindling is just wood or paper or both. It's not dangerous. And these things can be thought of as kindling to the fire. So whether that's osteoarthritis, disc bulges, movement differences, posture differences, rotator cuff damage, those things on their own are not inherently dangerous. And there's plenty of people in this world who have these problems and aren't in any pain whatsoever. And we know that from really good scientific research. And you only have to look at Mr. Usain Bolt, who has quite bad scoliosis. So we think about movement differences and posture differences and things. He has quite bad scoliosis, and he's the fastest man in the world. He doesn't really complain of any symptoms. So these things are kindling to the fire. What you need for pain to occur or for that kindling to become a fire is a strike, some oxygen, and a flame. Now, those things can be seen to increase painful experiences. So stress, whether that's physical or mental, physical overload, poor sleep, fear of pain, expectations of recovery, beliefs about what pain or injury is, those things can influence how much pain we experience, and they can set off those previous kindling messages. So osteoarthritis can be asymptomatic and you can not be in any pain whatsoever, but all of a sudden, if you had a little bit of physical overload or stress at work, you start sleeping poorly, you don't really think that your knee osteoarthritis is going to get any better, and you believe that you shouldn't exercise because it's going to wear out your knees, that is a recipe for striking that kindling and giving you a more painful experience than you should have. This is a question I get asked quite often. How can fear, beliefs, and expectations drive pain? And the reality is, it changes the way we move. If we look at these two different people crossing a bridge, or one's a person, one's a monkey, the person is debilitated by fear. They are scared that they're going to fall. They don't want to move. They're tight. They're not moving. Whereas the monkey, he has less fear. He's not worried about, there's no danger signals there for him. So he has lots of movement variability. He's moving really smoothly and in lots of different ways. The fear and worry haven't changed the way that he moves. Similarly, that can apply to pain. If we're scared of moving or worrying or doing a particular task, it changes the way that we move and it adds extra physical load to the system. And personally for me, sitting on a plane, I experience this every time I do it. I tense up, I grind my teeth, my shoulders get tense, I sweat. Fear and worry have a physiological relationship with our body. They make us change how we move. So it comes down to this interacting factors. Now, if we imagine this dotted line is a painful experience and anything above that is painful, all of these things underneath that we've talked about so far on their own are not enough to get you over that line. So physical load on its own, in most cases, is actually fine. And there can be varying that, that bar can move up and down if you have a particularly tasking job, which means it would take less of the other things to tip you over the line. But it's about a combination of factors that always contribute to why you might experience pain. And it's only when they're piled on top of each other that we end up crossing that line. And this is what can give us a painful experience. And it's all about, I like to think about what's in our mug of life. So physical load would be one of them. Stress, poor sleep, as we've talked about, fear of movement, and history of pain. And sometimes the mug can overflow. And that overflow is why we experience pain. And that can happen with flare-ups in particular. Now, you might go through a period of time where your symptoms are relatively low, you don't experience too much pain, and then all of a sudden you get a period where it's really intense. And that's because of these interacting factors. There will be multiple things in your life that are contributing to why you might get pain, or you might suddenly increase your physical activity or your physical load. If you suddenly increase it and don't do it over time, that can tip you over the edge. But we know that hurt doesn't always equal harm. So we know even if it's flared up, there's no more damage there. It's like you've got in the shower with your sunburn. There's no more physical damage there, but it's more sensitive. That's why we need to think about everything that's in your glass of life. And if it has flared up, it has the ability to flare back down. And we know that. So what we need to do is take a step back, evaluate what's going on in our lives at that moment, and not just with regards to whatever's painful, whether that's a knee or a back or a shoulder. Take a step back, think about the physical things. Of course, think about the physical things that are affecting that joint or body part. Have you lifted a little bit more? Have you suddenly started to run a bit more? Have you had to move jobs in work and you're suddenly doing a lot more in a certain job? That would be an example of a physical stressor that's suddenly increased. Gradual increases in physical load are a good thing, and I definitely do not think that they're bad for you. We should always gradually increase our ability to load our bodies. But if there's a sudden change, that could be a physical flare-up. But we need to think broader than that as well, and we need to think about everything else in our life. Is a daughter getting married? Is there anything going on at home? What the relationship's like with your bosses or colleagues at work? Has anything changed? Those other stresses can also cause a flare-up. And it's important to note, so that you can talk to your physiotherapist or talk to your healthcare professional and think about how you can manage all of those aspects. If you just think that it's always because of damage in one place in a joint, then you're going to find it more difficult to find a solution for that problem, because most of the time it's not because of a change in physical damage at the knee or the back. So the key is to be patient, remember exercise is good for you, and keeping active is the best option for long-term health. It's really important that we understand that exercise and activity are the best options for our long-term health. They'll help keep us in that 75% of people who don't need knee surgery if it's knee osteoarthritis we've got. It will keep us in work longer. It will keep us doing the things we enjoy longer. So it's really important that we understand that. Now, let's move on and talk about resilience. Now, resilience would be like increasing the size of our cup. So if we think about our mug of life and we think about all the stresses in it, one way to reduce that flare-up or that painful experience is to take away some of the stresses, reduce physical load, manage relationships outside of work, manage relationships at home. If that's not possible, or if it's something that doesn't seem doable, then what we have to do is get a bigger cup. We have to get a bigger mug. We have to be able to cope with the physical stresses and the psychological stresses that are around us. So we have to get a bigger mug to be able to cope with those. And that mug would be becoming more resilient, improving our levels of resilience to the same stresses. But what is it? So robustness is being strong and in good condition in the first place. It's the ability to withstand or overcome adverse conditions. So if you're physically and mentally robust, you can pretty much take what comes at you. You're strong to cope with physical and psychological stresses as they are. You're a robust person. A resilient person has the capacity to respond to pressure and cope with the demands of daily life, so they can bounce back from adverse conditions. So whether that is a flare-up, whether that's something that's happened at work or at home, your ability to bounce back from adverse conditions is your level of resilience. And if you're in pain, it's resilience that we're concerned with, because obviously that's an adverse event that we need to be resilient to. So robustness can reduce the risk of sustaining an injury in the first place, and resilience can allow effective coping with recovery from an injury. So resilience is what we're interested in. Resilient people accept what comes at them with flexibility rather than rigidity. Now, this is a really important point. Acceptance is key to resilience. Understanding that pain is a part of life, understanding that pain and stress happen, and knowing that we can't always change those things is really important. If we're constantly fighting against the fact that, why did this happen to me? It shouldn't have happened to me. My knee should be better by now. My back still shouldn't hurt when I do this at work. That is a recipe for not being resilient. We're ruminating there. We need to be resilient and accept the fact that sometimes these things happen, and how can we move forward from them? Resilience is not a passive quality, but an active process. And this is really important, because it's really easy to think that people are either born resilient or they're born not, that it's a genetic thing and you're either a resilient person or you're not a resilient person. And that's not true. You can improve your resilience. Resilience is an active process that if you put your mind to it, you can improve. And developing resilience is a personal journey that involves thoughts, behaviors, actions, and experiences. So there's lots of different things that you will need to do to improve your resilience, but you can do some really simple things to start with that I'm going to run through in a minute. So how can we develop physical resilience? Improving how strong you are will help in most cases. So the saying goes, you can't go wrong with getting strong. And there's not many situations where improving your strength is going to be bad for you. So getting a bit stronger is a good place to start. Exposing yourself to lots of different contexts gradually over time. So that's really important, to be able to cope with physical things in lots of different contexts. If, for example, you lift weights or do a lot of DIY or gardening at home, but then all of a sudden in work you find yourself in a little bit more pain, that's not a good way to transfer the context of the physical activity you're doing outside of work. What you might find if you take a step back is realize that actually in different contexts you do a lot of physical activity, but it just doesn't always feel the same in different places. So exposing yourself to lots of different contexts and movements and physical activities in lots of different places at different times with different people can make you a more physically resilient person. Practice movement in lots of different ways. So movement variability is a really good thing. A rigid way of moving and only moving in one way is not good for us. One, because it overloads certain tissues more than others, and another one is because our bodies get used to moving in a certain way, and any deviation from that then, or any movement outside, our body gets a little bit sensitive to, and it can increase pain. Gradually over time, if we can get used to moving in lots of different ways, bending, twisting, stepping up, stepping down, stepping sideways, all of those different things, it can improve how physically resilient we are. Being in general good health always helps. So working on our BMI, not smoking, having a good diet, making sure our blood pressure is low, reducing our alcohol intake, all of these things can help our physical resilience, quite obviously because we're generally going to be in a bit of a healthier place. Manage the known stressors, so try to reduce what's in your mug of life. So almost evaluating quite regularly what is in your mug of life and how you're feeling at any one time when you're in pain, and looking at why that might be, and managing anything that's manageable. So obviously things like genetics and history of pain we can't change, but things like BMI, physical activity levels, relationships at home and at work, those are things we can start to manage. Ensure good sleep, length and quality. So it's not just about the length of sleep, the quality of sleep is also important. So making sure that we have good sleep hygiene procedures, so making sure that we're not looking at screens before, an hour before bed, making sure that we're always trying to go to bed at the same time, wake up at the same time, getting into a good sleep routine, making sure that if we do wake up in the night, we don't stay in bed and just toss and turn. You'll start to associate bed then with not sleeping. The best thing to do if you can't sleep very well and you find yourself tossing and turning, get up out of bed, have a walk around, try not to switch any lights on. Certainly don't look at your phone, because that's going to be a blue light that's going to keep you awake for longer. So ensuring we have good sleep length and good sleep quality are paramount to developing physical resilience, because it helps us recover and maximize our physical opportunities the following day. Developing psychological resilience is also very important. So keeping good company is the first thing that we need to do. Cherish the social support you have around you, interact with people that you enjoy spending time with regularly, and make sure that you have the support around you that you need. Learn how to reach out for help and also serve as a listening ear. So not just asking for help from the people that you in your social support network, but also making sure you serve as a listening ear. Being a good listener can actually improve your ability to be resilient and improve your psychological well-being. Treating problems as learning processes, so trying to have a different perspective on problems when they arise in front of us, trying to not treat them as something that is a barrier, but something that is an opportunity for us to learn and to improve as a person. Practice acceptance. We've talked about this. Stress and change and pain are part of life. Healing takes time. If we accept that and become a bit more like bamboo, we're blowing in the wind and we're being a little bit more flexible, we're accepting what comes at us because we know stresses and pain is going to be there, it goes a long way in developing our psychological resilience. Celebrate successes. Nurture a positive view of yourself. If you're doing well at work or at home, or there's something you're proud of, make sure people know about it. Celebrate those successes. Take positive action. It provides a sense of self-control, even if it doesn't remove the difficulty. If you're in pain and you're struggling with day-to-day daily tasks, take some positive action towards getting something done. It might not be the exact physical task you want to perform, but doing something that resembles it, or something you feel like you can do, or half the task or an eighth of the task. But taking positive action and moving towards doing something you feel like you can do gives you that sense of control. It's not going to get rid of the pain immediately, but it's going to give you a sense of ability within your life. Practice optimism. Nothing is either wholly good or wholly bad, and that goes back to treating the problems as a learning process, not seeing problems in our lives as barriers, but opportunities to learn new skills, learn new tasks, modify what we do at the moment to fit our lives a little bit better. Optimism is a really important thing, and has got loads of proven physiological benefits for pain. More optimistic people experience less pain. And this brings me on to my last point, and it's about using our awe in times of difficulty. So it's about being optimistic. As we've just said, it reduces our ability to experience pain. Active. Being active is always a good thing. Improving our exercise regularity, improving how we do, improving the variety of what we do, the different contexts we do it in, all go towards being more resilient. So if there's a time that you're experiencing pain, use your awe to get out of it. Thanks very much for listening, and I hope that was helpful.